Simulation is one of those technologies that was developed in the last 10 to 20 years that really supplements medical education, and it gives that learner an opportunity to be in the clinical setting and taking care of mannequins or actually live patients in order to give an opportunity to learn better and practice better before they go out into the clinical environment. So the Simulation Center at IU is different from other medical schools in that we have a partnership with the hospital, the healthcare system, IU Health, and then also with the School of Nursing, IU School of Nursing. So what that means for our learners is that we have a large space for them to work in, for them to practice really delivering, difficult conversations to some of our standardized patients, and at the same time going and conducting procedures in our operating room. And we even have the back of an ambulance where they can resuscitate a patient in the back of an ambulance. Again, it's a 30,000 square foot facility completely dedicated to simulation education. In order to give our learners the best experience here at IU, our Simulation Center has multiple different types of mannequins and actual actors as well that can deliver education. So our mannequins go from a newborn to a baby to a child to an adult to even a delivery mannequin. In each of these, we also have different types of skin tones to replicate the type of diversity that we see in our patients. The other thing we have is actors that portray standardized patients, and these again have multiple different genders and ethnicities to deliver a type of education to our learners that they can't get anywhere else. So we get very good feedback on their experience here for students. At first, they find it somewhat intimidating because they actually have to be in a clinical scenario and perform, but afterwards they find the training is unlike any other experience that they have. And most recently, we had some experiences where standardized patients were doing physical exams with the students, and they said that was one of the most rewarding experiences they had in their training. Our philosophy here at the Simulation Center at IU is to make sure that students have an innovative and unique experience, and that we're constantly staying in the front edge of medical education by delivering the most highly realistic and yet highly effective technology that we can to drive education.